Hey y'all, my name is Reed and welcome back to Psychoactive. So I wanted to start out my channel by providing some basic information about pharmacology for anybody who has limited or no experience in this field. I'm also going to couple up these videos with some videos about basic cell biology for anybody who has little or no experience in biology in general, just so that people can understand what I'm talking about in later videos. One of the principal ideas of pharmacology is the term bioavailability. And bioavailability means the amount of drug that is in a person's blood at any given time. Bioavailability is important because it can determine whether or not a drug can perform its intended action, therefore producing its desired effect. A drug action describes how a drug works on the molecular and cellular level. The drug effect is the ultimate outcome of taking the drug. For instance, some antibiotics might affect the stability of a cell wall of a bacteria. That is the drug action. And the effect of that antibiotic is the death of the bacteria. There are 5 factors affecting drug action: routes of administration, absorption and distribution, binding, inactivation, and excretion. And what we're going to talk about today is the routes of administration. Now, a route of administration is how the drug is introduced into the body. Some of these you'll probably be familiar with, and some of them you might not. There are 10 basic routes of administration. There's oral, rectal, intravenous, intramuscular, intraperitoneal, subcutaneous, inhalation, topical, transdermal, and epidural. The first one I'm going to talk about is oral. Oral administration basically means that it's taken into the mouth, goes down the esophagus, and is processed in the stomach. And in the stomach, it is dissolved, and it will go through either the stomach wall or into the wall of the small intestine. This is usually introduced into the body with pills, tablets, liquids, or capsules. Now, for a drug to be effectively administered orally, it has to be resistant to the environment of the stomach. The stomach is full of acids and enzymes that are designed to break down different substances. For a drug to have its desired drug action, producing the desired effect, it needs to be able to survive the high acid content of the stomach and all of the enzymes that are designed to break down any intruders that might cause some problems. One such drug that is not resistant to the stomach's environment is insulin. Insulin will be broken down by the stomach's enzymes and therefore has to be injected instead. Now, there are some advantages to oral administration, such as it's safe. It's hard to mess up an oral administration of a drug unless you take a lot of it, or if you start choking on it, which that's a whole other problem. It can also be self-administered really easily, so you don't need special medical equipment or special medical personnel in order to administer a medication orally. Also, a drug can be removed with stomach pumping, which is useful for if somebody takes too much of a drug accidentally, or if somebody has taken a drug in conjugation with a different drug that is causing some problems. They can be removed by pumping the stomach, therefore removing the drug and everything else with it. Some disadvantages are it's slow to absorb into the bloodstream, and it has a highly variable absorption rate because it depends on the contents of one's stomach. This means that the levels of the drug in the blood are less predictable than some other methods, and doctors don't like that unpredictability. Now, most drugs are absorbed in the small intestine, which comes right after the stomach in your GI tract. This is because they are generally ionized in the environment of the stomach. That means that they are either positively or negatively charged while in the stomach because of the acids or enzymes that are affecting them while they're in the stomach's environment. A drug cannot be absorbed through the lining of your stomach wall or small intestine while they are ionized, because only things that are lipid soluble, which means things that are soluble in fats, can go through the lining of your stomach or your small intestine. So, once a drug leaves the stomach, it is no longer ionized generally, and therefore can pass through the lining of your small intestine. So, when you're taking a drug of some sort, and they tell you to take it with a full stomach, this is because they are trying to increase the amount of time that the drug spends in the stomach and therefore decreasing its rate of absorption. Now, rate of absorption means the amount of time that it takes for a drug to enter your bloodstream. When your stomach is full of fatty foods, it decreases the rate of absorption, which increases the amount of time it takes for the drug to be absorbed into your body. So when people say don't drink if on an empty stomach, it's because alcohol is only absorbed through your intestinal wall. It's not absorbed in the stomach. So the longer it stays in your stomach, the less of the alcohol is in your system and the less drunk you're going to be, which means you can have a better night. Also, if you're instructed to take some sort of medication before a meal with lots of fluids, they're trying to get the drug through your stomach and into your body as quickly as possible. They're trying to increase the rate of absorption by getting it through your stomach and into your small intestine and into your bloodstream as fast as it can be. Then you can eat food and you'll be fine. The second route of administration is rectal. This is generally accomplished by having some sort of drug-filled pellet called a suppository stuck up into your rectum. The coating of the suppository dissolves over time, which slowly releases the drug into the lining of your rectum and then into your bloodstream. Now, rectal administration is really good for patients who are vomiting or are unconscious, or for infants or anybody else who generally can't take oral administration of drugs. Now, the main disadvantage of a rectal administration of medication is that the absorption rate is pretty irregular, so the bioavailability is hard to predict. Now, the third route of administration is intravenous administration, also called IV. This involves injecting the drug directly into a person's vein, therefore directly introducing it into the bloodstream without having to pass through any membranes. Now, this is one of the fastest and most accurate ways to introduce drugs into the body because it's injected directly into the bloodstream and therefore doesn't have to pass through any membranes. Now, since it is injected directly into your bloodstream, it is very difficult to reverse this process. You can't pump your stomach like you can with an orally administered medication. Also, it requires some special medical training and special medical equipment, which isn't as available to some people. Since IV medications are introduced directly into the blood, they are rapidly spread throughout the blood and can cause that sensation of a high or a rush, which can lead to the abuse of some drugs. The fourth route of administration is intramuscular, also called IM administration. And this is where the drug is administered directly into the muscle, not into the bloodstream. And this is an alternative to IV administration, and it is slower and has a more even absorption into the blood. However, this can cause some localized irritation around the point in which it is injected, and it also requires some special medical equipment and medical training to administer. Now, it generally takes about 10 to 30 minutes for a medication that's introduced via IM to be absorbed into the body fully. Now, this rate can be slowed when the medication is coupled with some vasoconstrictors. Vasoconstrictors are drugs that cause your blood vessels to close or to shrink, which means that the blood flow to the area of the muscle is slowed, so the rate of absorption is slowed along with it. The fifth route of administration is intraperitoneal administration. Now, intraperitoneal administration is where a drug is injected through the abdominal cavity and into the peritoneum, which is the cavity that surrounds the abdominal organs. Intraperitoneal administration is rarely used in humans, but it's often used in small lab animals, such as mice and rats. Now, this is generally because the veins of a mice and a rat are really hard to get to. You can kind of get to them through the tail, but sometimes it's just easier and more efficient to go through the intraperitoneal way. Now, the effects of intraperitoneal administration are rapid, but not as fast as the effects of an IV administration, and the absorption rate is a little bit variable depending on where in the peritoneum it is injected. The sixth route of administration is subcutaneous administration. This is where the drug is injected into the skin. Absorption is variable depending on blood flow to the site of injection. Now, rubbing can help dilate those blood vessels, which will help the drug to get into the bloodstream and get carried throughout the body, thus increasing its rate of absorption. Now, subcutaneous implantations is another method of drug administration. This is where a drug is put into another pellet or it is mixed with some non-aqueous liquid and put into the subcutaneous tissue. Hormones are often administered with subcutaneous implantation. Some examples of this are Implanon and Nexplanon, which are contraceptives that can prevent pregnancy for up to 3 years. Also, most vaccines are introduced with either IM or subcutaneous administrations, except for the BCG vaccine and the smallpox vaccine. The seventh route of administration is inhalation, where drugs are absorbed through the lungs. Some examples of this are asthma medication, nicotine through the form of cigarettes or cigars, or THC through smoking them blunts. Now, there are some advantages to inhalation administration. For instance, there are lots of capillaries surrounding the lungs and they go directly to the heart, so the rate of absorption is really high. And there's no need for any special medical equipment other than something to aerosolize the medication for you to breathe it in. However, like IV administration, inhalation comes with the increased risk of abusive drug behaviors and addictive behaviors because of the rapid distribution of drugs through the bloodstream. Also, inhalation comes with some amount of danger because tiny particles that are inhaled with the drug could cause some damage to the lungs, such as all of the gunk and nasty stuff that's in cigarettes that you should not be putting into your body. Now, inhalation is one of the preferred self-administration methods when oral administration is too slow or when a drug will be destroyed inside the stomach. The eighth route of administration is topical. Topical administration is administration of drugs directly to a mucous membrane. Some examples of some mucous membranes are the conjunctiva of the eye, the inside of the mouth, the nose, the vagina, the rectum, and the urethra. Topical administration generally has local effects, but can also have some widespread effects if it can get introduced into the bloodstream rather quickly. For instance, intranasal administration of a drug has only one layer of tissue that it needs to get through before it gets to the bloodstream. So it has both localized and widespread effects of the drug. Intranasal administration may also bypass the blood-brain barrier, which is the barrier that separates the rest of the bloodstream and the brain. This is why some neuropeptides, such as oxytocin, can be administered intranasally to get it into the brain through the blood-brain barrier. To be introduced intranasally, the drug doesn't necessarily have to be dissolved. It could also be ground into a fine powder, but that can cause lots of irritation inside of the nose and can cause some other problems. The ninth route of administration is transdermal administration. This is when a drug is introduced through the skin, such as with patches. This allows for a slow, controlled administration of a drug, while also being painless and not requiring any special medical equipment. Some disadvantages of transdermal medication administration is that it could cause some irritation around the skin where the patch is placed. And this is only good for lipid-soluble drugs because it has to get through so many layers of tissue before it can reach the bloodstream. There are tons of uses for transdermal administration of drugs, such as preventing motion sickness with scopolamine, reducing cigarette craving with nicotine, relieving angina pectoris with nitroglycerin, or providing hormones after menopause or for contraceptives. And what's really cool is that they can also be used for mass vaccination campaigns during a pandemic because it's so much easier to put on a patch and take it off and then put on a different patch to a different person, take that off, than it is to go around with needles poking everybody. And this method of vaccination might also reduce the risk of a nurse accidentally poking herself with a needle that she just used to give a vaccination to somebody else. Now, the 10th and final basic route of administration is epidural administration. Epidural administration is administered directly into the cerebrospinal fluid that surrounds the spinal cord. So this means that a big needle goes into somebody's spinal column and releases the drug directly into the column. This bypasses the blood-brain barrier because it gets injected directly into the cerebrospinal fluid that surrounds both the brain and the spinal cord. Now, the onset of a drug administered epidurally is very rapid, but it's also irreversible because it's already in the cerebrospinal fluid. This method also requires special training, and it comes with the risk with some nerve damage from the injection process. There are also some other routes of administration that are akin to this, such as intracranial, which is the injection of a drug into a localized area of the brain, or intracerebroventricular. Long word, but is really cool. which is used to administer drugs to the brain vesicles, which are these big open pockets of cerebral spinal fluid in the brain. And those are the 10 basic routes of administration. If you enjoyed this video, make sure to give it a thumbs up below. Now, if you want to get right to hearing about some drugs and how they work, head over to clubcore.com. I'll provide a link in the description. This is run by one of my professors from my university, Dr. Kaur. She is awesome, and I loved taking her class, and her class is really what inspired me to make these videos. I'll also provide a link below to a podcast that I made with one of my classmates while we were in her class about the history of tetrodotoxin, how it works, and why I got interested in it in the first place. Spoilers, it has to do with zombies. And let me know what you want to hear about in the future. If there are any drugs that you want to hear about or any more biology questions, let me know and I'll look into it for you. So have a good one, y'all, and make sure that you exercise those brains daily.